至关重要。疫情防控越是到最吃劲的时候，越要坚持依法防控。随着各地陆续复工复产，强化社区防控网格化管理，做好春节后返程疫情防控工作非常重要。今天发布会的主题是加强基层社区疫情防控的有关情况。我们请来了民政部基层政权建设和社区治理司司长陈岳良先生，社会事务司2级巡视员杨宗涛先生，养老服务司副司长李邦华先生，北京市月坛社区卫生服务中心主任杜雪萍女士，就指导发挥城乡的社区自治、服务功能和宣传动员能力，共同做好疫情的群防群控工作，来回答大家的问题。今天我们还请来了中科院心理研究所陈雪峰女士解答健康知识。首先通报一下疫情情况。2月9日0时至24时，各省区市和新疆生产建设兵团报告新增确诊病例3062例，其中湖北2618例，新增重症病例296例，其中湖北258例，新增死亡病例97例，其中湖北91例，安徽2例，黑龙江、江西、海南、甘肃各1例，新增疑似病例4008例，其中湖北2272例，当日新增治愈出院病例632例，其中湖北356例，解除医学观察密切接触者29307人。截至2月9日24时，各省区市和新疆生产建设兵团报告现有确诊病例35982例，其中重症病例6484例，累计治愈出院病例3281例，累计死亡病例908例，累计报告确诊病例40171例，现有疑似病例23589例，累计追踪到密切接触者399487人，尚在医学观察的密切接触者187518人，累计收到港澳台地区同胞确诊病例64例，其中香港特别行政区36例，澳门特别行政区10例，台湾地区18例。通过今天的数据分析，武汉、湖北全国治愈比例均明显上升，其中全国治愈比例8.8%。
In Hubei province, 6.1%, while on the 27th it was only 1.7%, and in Wuhan city, the cure rate has increased from 2.6% on the 27th of January to 6.2% as of yesterday. And this increase in the cure rate has shown the effectiveness of our prevention and control measures and the further supply of hospital beds. Recently, the media friends are very much concerned and interested in the China WHO Joint Inspection Team, with the team is now named as China WHO Joint Experts Investigation Panel. The purpose of this joint investigation is to conduct in-depth communication between Chinese and WHO experts, so as to prepare us with new suggestions for the next step, prevention and control. Today, advanced team of WHO has arrived in China, and there will be detailed discussion between the two sides. We welcome experts from multiple countries, United States included. We believe with the bilateral communication between WHO and China, there will be specific arrangements of the investigation team's efforts and agenda in China. Now, we'd like to take questions. Please identify yourselves. The floor is open for questions. Journalist on the first row, please. Thank you. I'm from China Community News. My question is, currently, community is the priority of prevention and control. As people are coming back to their workplaces, there is more intense work at the community level. How can community workers be supported to enhance the effectiveness of prevention and control at community level? I'd like to ask the DG Chen Yueliang from the Ministry of Civil Affairs to answer the question. Thank you for your care of community workers. Since the outbreak, thousands of community workers are working in communities. On average, 6 community workers take care of 1 community, which is on average 350 citizens. This is even higher in urban areas. They are under great work pressure. News coverage has shown that there are community workers who are pregnant, but they are still working on the front lines, and they didn't even ask 1 day off. They are implementing their obligations as the community workers and made great contribution to reining in the spreading of the disease. The Ministry of Civil Affairs has lately addressed a letter to community workers across the country, and we expressed our gratitude to their great efforts. We encourage community workers to work for the general public and forge ahead to go through this rough patch. We support community workers with solid efforts and practices, and we need to alleviate their work pressure. To this end, departments of the Ministry of Civil Affairs have initiated online module for work guidance, guiding localities and communities to leverage social organizations, volunteers, and community workers. And we've set up online epidemic prevention and control knowledge sharing platform, thus rendering support to community workers. Localities are also leveraging and mobilizing the party members. And there is an online work process, streamlined work process. Cadres and party members have mobilized community counterpart assistance. Thus, community workers are supported in their efforts. We've learned through various media channels that some community members and citizens are all involved in the volunteer work. They have joined the work of the community workers. When citizens find there is a shortage of face masks for the community workers, they give them their own masks. And the self-protective measures have been advertised in the community chat room. Their efforts are in the mind and heart of all the citizens. The governance capacity of community workers is going through a test in face of this epidemic outbreak. Governments at all levels and departments should guide community workers to ensure safe, fair, and transparent work. They should perform their duties in accordance with law. Since there are many resorts to helps, we suggest the building of a queuing system to ensure fair services are provided to the general public. Epidemic does not have a heart, but people have warm hearts. As long as we join and coordinate efforts and build a great wall of prevention and control, and coordinate efforts from all parties, as long as we understand and support each other, we believe we will fight off the epidemic. Thank you.
继续提问。
Thank you. Next question. On the front wall, the journalist, the gentleman. Thank you. From China Population News. For people who stayed at home, do we have specific follow-up from the community workers? Any specific requirements concerning such follow-up frequency? Madam Du, could you please answer the question? Okay, for people who stayed at home and have the self-quarantine, they are managed by the local communities or the local governments. For such self-monitored quarantine, the neighborhood committee, the healthcare professionals at the community level, and of course, the particular individuals are all accountable. Just now you mentioned the inspection visits. Of course, the neighborhood committee staff can wear masks and then deliver the relevant materials to the individuals at home. Of course, the community workers do not need to go inside. But once the individual has fever, then of course the community staff will be contacted and the community level healthcare professional will be consulted, and if necessary, they will transfer the patient to the relevant hospitals. So each of them has his or her own people at home, and it is reported that sometimes the same thermometer is used, so there's some concern about the potential spread of the epidemic caused by the community workers' household visits. So any precautions taken? Mr. Chen, thank you. It's a very good question. Of course, the prevention and control at the community level must be evidence or science-based. According to my knowledge, my understanding, the communities are now aware of the risk of cross-infection by such household visits or by sharing the pens and the thermometers. So now the communities begin to use various smart platforms and keep communication with the residents with such smart approaches. They are no longer using the same pen. Instead, they are using the WeChat program or the WeChat group to get information and to try to avoid the risk of cross-infection by such face-to-face communication. Everyone should be held accountable for his or her own health. And everyone should be honest in reporting the health conditions or health status of himself or herself so that the community workers get well informed and the local governments can make accurate judgment or evaluation and adopt precise measures, which are the key steps in winning the battle against the epidemic. The community workers need to be be insured for the relevant material supply. And of course, they are to be well informed of the health knowledge and the prevention of the epidemic. So on the one hand, protect themselves, and on the other hand, engaged actively in the epidemic control and prevention. I would also like to appeal to the internet companies like WeChat and Alibaba. Maybe you can develop some software which is for public good. They would be very helpful. Okay, next question. The gentleman on the second row. I'm from Red Star News. On February the 3rd, Hubei suspended the marriage registration. When is such a service going to be continued? Thank you for your concern with the marriage registration services. The marriage registration office is usually very busy, with lots of people visiting the office. The couples must come to the office to get registered for their marriage, and at the same time, the officers working in the office are asked to verify or validate the relevant qualifications, and the registrants are required to fill in the registration forms. So the marriage registration office is a high-risk office for the potential spread or transmission of the epidemic. That's why it has already been identified as a key risk point or risk location. Since the outbreak of the epidemic, the marriage registration officers have taken prudent measures, and they have suspended the marriage registration services, which has been understood and supported by the general public. Hubei province is the epicenter of this outbreak, and starting from January the 31st, the office received the notice and made the announcement that it's going to suspend the marriage registration services. This is out of the sense of responsibility to the general public. As far as we know, in Shandong and the Zhejiang provinces, they also suspend the marriage registration work, and in some other provinces like Jilin and Guizhou. In some localities within the province, the marriage registration services are temporarily suspended. So the suspension of the services is the result of the consideration of the local conditions. Also, we have strengthened the disinfection practices and also the temperature monitoring and other protective measures. We advocate the appointment system with the smart technologies and control the visits to the office. So such appointment practice is designed to reduce the gathering of the visitors and to reduce the shorten the stay of such visits.
We encourage the registration to take place off the peak of the epidemic. And all these arrangements are to respond to the needs of epidemic prevention and control. And for localities where the business has been suspended, given the changes or the improvement of the situation, the business will be resumed in an incremental fashion. So we ask for the general public's understanding at this very special moment. For the inconvenience caused by the suspension of the registration business, we also look forward to your understanding, because life and safety prioritize over everything, and we believe as long as people are in love with each other and can stay healthy, it doesn't really matter which day is selected as the registration day. Thank you. Next question, please. Journalist on the second row, please. I'm from CNR. My question is on old-aged care homes. We've noticed that there is the second edition of epidemic prevention and control for old-aged caring and nursery facilities. What are the changes in the second edition? The Spring Festival has passed. If the old-aged citizens do not feel well, can they go back to the nursery facilities? I'd like to ask DDG Li Banghua from the Old Aged Services Department of Ministry of Civil Affairs to take the question. You've asked several questions. First, precaution measures adopted in old-aged nursery homes. In our guidance, the prevention control measures of the old-aged nursery homes, there are three suggested prevention and control measures. First, improve the organization and compiled the emergency response plans. Second, these nursery homes have enhanced entry and exit management and has quarantined the homes to avoid imported infection. And third, improve the internal services to assure the old-aged citizens. We have also stepped up the management of the staff in these nursery homes so that we can unite forces to go through this rough patch. And your question is also directing about the changes in the second edition. On the 28th of January, the Civil Affairs Ministry has issued the first edition of the prevention and control measures in old-aged nursery home. And after that, our ministry has convened the experts to follow the implementation of Edition 1. And we've also been watching closely the prevention and control needs as the epidemic situation changes. So we have issued the second edition lately. Compared with the first edition, we've made adjustments on two fronts. First, we improved further the entry and exit management of the old-aged facilities. The major risks are from the possible potential imported risks. So the guidance has explicitly pointed out 6 kinds of no entries. For visitors who have been to Hubei province, visitors who have been in contact with confirmed cases or suspected cases with symptoms of vomiting and a fever. So altogether, we've listed 6 types of no entries. Some old-aged citizens visited their family members during the Spring Festival, and as the Spring Festival approaches to its end, these people are going back to nursery homes. And there are also newcomers to the nursery facilities. We've also improved the procedures. We request those returnees and newcomers should stay in their homes for 14 days. If there is nothing abnormal, they can come back to the facilities. The second, we've also been looking at the specific arrangements during this special period. Sometimes the old-aged citizens will have to visit hospitals and they have to leave the facilities. And sometimes they may register some suspected symptoms. And if there is the cropping up of certain suspected cases, we've also listed procedures and standards to follow in case of these situations. So all these have been some follow-up changes in response to the new needs. We've optimized the original 45 provisions to the current 34 provisions in the guideline. As to the returnees to the old-aged nursery homes after the end of the Spring Festival break, in the second edition, we have listed the notes to be taken if they are going to return to their homes. If the old-aged citizens can be cared well by their family members, we suggest they stay home longer, because compared with individual homes and households, the nursery home is relatively more has a higher density of people. But for the old-aged citizens who have to live in solitude and there are no family members to take care of them, of course they can return after 14 days of self-quarantine observation. This approach is to ensure the safety of all the old-aged citizens in and out. As to the visits from family members, many nursery homes have closed doors and minimized the entries and exits during the epidemic prevention control period. And for those family members who want to visit the old-aged citizens, we suggest the visits can be conducted via video or telephones. And of course, in very special conditions and environment, like the old-aged citizen is suffering a severe disease or is in a moribund stage, of course, we have to first ensure the safety of everyone in the nursery home, and we will conduct certain temperature testing over the potential visitor. But the general principle is to minimize the daily and regular visits, with the exception to some very extreme cases. We will continue to monitor and ensure the service quality in these nursery facilities. That's my answer. Thank you. Next question, please. Journalist on the third row, please. Thank you. I'm from Hunan Broadcasting Station. Community workers have made great contribution. In some places where there is no confirmed case, the control in community is not strictly following the procedures. And in places as such, should prevention control efforts be ramped up? The next question is, how can we ensure precision prevention and control at the community level? I'd like to ask DG Chen Yueliang from the Ministry of Civil Affairs to take the question. This is an important issue. Yes, indeed, in certain localities, community is understaffed and supplies are in great shortage. The prevention and control measures are not followed strictly, and there is lagging behind of such efforts.
It is necessary to overcome the gap and the shortage. So for the next step, we need to continue the following efforts. First, to implement to honor the responsibility of the prevention and the control. the communities are held accountable for their specific prevention and control measures. And for key locations with around-the-clock monitoring, there should be dedicated staff to do so. If they are understaffed, the public servants are asked to can go to the communities to offer help. And second, to strengthen the material supply. For the key materials for epidemic prevention and control, there should be adequate supply. For community workers, the relevant knowledge training and skill training should be conducted. And also, the community workers should take the break according to a well-established plan to get some break. And also, thirdly, to implement the control measures such as the registration or record keeping for visitors or for people entering the community. We can adopt information technology like the QR code to ensure the record keeping. The internet companies are encouraged to make use of the existing platforms or developing new platforms to improve the community management. For the public facilities, the roads, and the devices within the community, there should be regular disinfection and maximize the performance of the control and the prevention measures. The community workers work hard while the residents are also mobilized and to take care of their health. Fifthly, to follow the laws and the regulations and implement the relevant measures for any acts that do harm to the community management. Such acts should be punished. Recently, we found that there was someone who spat on the elevator's buttons. This was totally insane, and such act should be punished. Furthermore, everyone should be mobilized to do a good job at the community level. Next question. The journalist in white. Thank you. I'm from China Family News. People who stayed at home and have the self-quarantine should have the medical observation at home. But many of the people do not have knowledge. So how can they get such knowledge, and who should they contact to get the knowledge? Well, for those self-monitored observation, the requirement is to have temperature taken twice every day, and also to have the fresh air ventilation at home. If there are symptoms, then the particular individual can contact the family doctor or the community healthcare workers. Let me give you an example. There's one community. Prior to the Spring Festival, a senior couple arrived at the Wuhan and arrived from Wuhan. So the local community should keep a record of the couple and ask the couple to stay at home. The couple stayed at home and had the self-quarantine, but on the 14th day of the self-monitored quarantine, the senior gentleman developed some symptoms. The community workers wanted to transport him to the designated hospital. However, the gentleman was reluctant, so after persuasion, he was finally transported to the designated hospital. For his wife, she did not develop any symptom, but she should continue to stay at home and do the self-isolation or self-quarantine. As we always say, the temporary quarantine is for the benefits of all. So we should be confident in our people, and also we will surely win the battle against the epidemic. Okay, next question. The gentleman on the third row from Chinese Society News. Now, as people are returning to work, do they need to contact their resident community? And the second question is, for people who return from Hubei province, should they all stay at home and have a 14-day quarantine period? Mr. Chen, to answer the question. Well, as people are returning to work, we expect to see the rise of such population exerting pressure on the local epidemic prevention and control. Up to now, many localities have already updated their epidemic prevention and control measures, requiring the returnees to report to the community and take their temperature taken. Also, they are to fill in the form of their travel history, and also to leave information about the travel history, like the aircraft number, the bus number, or the train number. And also for people from the key epicenters, they are requested to stay at home to have the self-monitored quarantine. For people who refuse to give the travel history information and refuse to stay at home for quarantine, they will be punished according to the laws and the regulations. The community will make every effort to implement the measures, and the individuals are requested to follow the requirements and arrangements of the community. If people develop any symptoms, they should immediately report to the local community. We are helping each other, so this is not against any particular person or individual. Rather, this is a protection for all. For people who return from Hubei province, whether they need to have the self-quarantine for 14 days, this is a question specifically addressed by the local governments based on the local conditions. So they can go to the community to get more information on that.
Journalist on the fourth row, please. Thank you. I'm from Wenhui News. The medical workers at community level also contributing to this process? What are their roles? When should they visit families? And for follow-up visits, what are the precautions for these community medical workers? We know their health is one of the linchpin in our prevention and control efforts. I'd like to ask Madam Du from the director of Yuetan Community to take the question. Medical workers, police officers, and community workers are working together to ensure the mass prevention and control. Big data and internet technology have been utilized to focus on the highly risky groups, the returnees from the visiting to epicenter. And there is the carpet searching grid management. If telephone communication is not enough, then family visits are recommended. The third level precaution is recommended to these home visitors. There should be classified precaution adopted. Thank you. Next question, please. Journalist on the fourth row, please. Thank you. I'm from China Women News. To curb the spreading of the epidemic, some communities have been sealed off, and some even forbid the frequencies, even has imposed certain limits on the entry and exit times and the frequencies. Will this be rolled out across the country? I'd like to ask DG Chen Yueliang from the Ministry of Affairs to answer the question. It depends. Since the start of community prevention and control efforts, localities have made effective explorations. The sealing off of communities have been an exploration tried by certain localities. Some cities have sealed off the communities in cities, and some rural areas have sealed off villages. To conduct a stricter management on the visiting people and the vehicles. These are the special precaution measures adopted in some key areas with the purpose of reining in the spreading. As to the further adoption of similar measures, it has to be dependent on the local specific situations. For example, in Beijing, a lot of returnees are coming back to the city, and the city of Beijing has issued 10 notes on the prevention and control. And there has been some ramped up efforts of community control. So you can see Beijing has adopted its respective measure according to its own conditions. In areas where such measures are needed, the measures should be taken with the prerequisite that the needs and demands of the citizens are first understood. Prevention and control have to be effective. The life, production, and work of the people should not be sealed off. Affection is not sealed off. Thank you. Given time constraint, we can entertain two last questions. Journalist on the right. I'm from CNR. We know community prevention and control is the priority, and there is a grid management system in place. How are the grids divided? Is it real carpet fine-toothed combing early to ensure early detection, early quarantine, and early treatment? I'd like to ask Madam Du to take the question. Grid management system has been an innovative concept in grassroots level development. In the response to the 2003 SARS outbreak, grid management has been proven effective. family doctors, GPs, police officers, civil affairs workers, and community workers have been convened to conduct a carpet searching and grid management. We have to search through the people who are on the household registration system to learn about the tenants, the migrants, as to whether each community can ensure carpet search and fine-tooth combing. I believe with concerted efforts it's possible. NCP epidemic cannot stop the steps taken by these community workers, and it cannot stop and seal off affection. Thank you. The last question is for the journalist on the first row. Thank you. I'm from Hong Kong media. Some communities have sealed off the entire community, in particular those communities where there is identified, confirmed, or suspected cases. How can the community citizens' daily supplies be ensured? To respond to the epidemic outbreak and ensure the safety and the life of the community citizens in many communities across different localities, there has been the sealing of communities and a very strict entry and exit control to avoid the potential of cross-infection. However, the sealing of communities cannot be adopted in an arbitrary manner. We cannot forget the needs of the citizens. And to meet the needs and demands of the citizens, localities have adopted the following measures. There is entry-exit card management with the proper measures taken for temperature monitoring. Of communities, one family can at least have one member to purchase the daily necessities. Second, there are also purchases conducted on their behalf so that their daily necessities can be provided as well. Third, there has been the organization and mobilization of supermarkets, franchised stores to set up a special kiosk in the community. Goods to certain designated places and then be collected later. So there is thus minimizing the potential gathering of people. There has also been disinfection on the faster delivery vehicles. A record is in place. Faster delivery boxes are also playing their role. So much for the questions. Now I'd like to ask an expert to give us some knowledge and know-how. Madam Chen Xuefeng, the Psychology Research Institute of CAS. I'd like to ask some most frequently asked questions about medicines. The question is that many general public tend to over-panic and they doubt they are confirmed cases whenever an uncomfortable symptom arises. The trauma stress response can be seen in many people. The fear of potential capture of the disease is one kind of trauma response. Some are self-administrating some drugs. 4 points of suggestions. First, if there is no symptom of fever, dry coughs, if you are not near anyone suspected a case or confirmed case, there is only a low likelihood of a potential capturing infection. Second, be sensible in your own analysis to see if your discomfort is just the symptom of the NCP. If indeed those are symptoms of NCP, then you should visit hospital. But if the discomfort is different, then visit the hospitals when it is necessary.
Third, behavior change. If you know that you are healthy but still you can't help getting worried, then you can try to devote your attention to other things like recreation or entertainment. So try to divert your attention to overcome the overreactions. It is worth noting that there are some people who believe that they have already been infected and they may go to hospitals and insist that they are ill. So this is a fairly serious psychological status, even though it only occurs to very few people. In case your family member has such symptom, you are suggested to bring him or her to the psychologic clinic or mental health clinics. And fourthly, you can take the initiative to seek psychological support in order to prevent any severe symptoms or any severe acts that may lead to very bad consequences. The mental health hotlines have already been established. Altogether, there are 361 hotlines established to provide mental health services. So you can call the hotline to get professional help. This is the first question. The second question is, the community workers are under great pressure, also psychological pressure. So what is the solution to that? For community workers, they are helping the people, they are protecting the people. So for community workers, we should respect them, understand them, and support them. We also suggest the local governments, especially those at the grassroots level, offer more support and ensure adequate supply of protective materials to the community workers. There should be more care shown to the community workers so that they can be fully engaged in the frontline work. For community workers themselves, there are also 3 suggestions. The first is to understand other people. In the work, sometimes you may run into people who do not understand you. So, even though the majority of the people are understanding, inevitably there would be someone who could not understand community workers' work. So you need to show understanding to them. Second, to understand yourself. Under the big pressure, community workers may also feel greatly stressed, eager to be stimulated and sometimes are very depressed or feel the sense of guilty. Some community workers feel that their memories and their sleep are affected. So this is a stress response. It is natural to understand that there could be such a stress response. But you can understand yourself and try to take some break. Have a deep breath and take some break. And the third is, if you run into difficulties, tell them to your supervisors, or you can call the mental health hotline to get support. We also encourage the localities to provide necessary psychological support and services to the community workers. The third question is about the elderly. They prefer to going outdoors and having square dances, but in the epidemic, people are confined to home or confined indoors. Indeed, for the elderly, the mental health services or support are needed. There are 5 specific suggestions to the elderly. First, to stay at home and make some exercises, body exercises as appropriate. Try to avoid going outdoors if you have to. Keep sound protection. Second is to practice the healthy practices. If you need to take medication, follow the doctor's advice and continue the medication. And the third is to only believe in the official news and information. Try to avoid the blind optimism or pessimism. Next, respect your family members' lifestyles. And the 5th suggestion is, if the elderly always feels the depression or pressure, he or she can call the mental health hotline to get support. I'd like to mention in particular that sometimes people may get panic by seeing the healthcare workers or community workers wearing the protective suits. Well, this is natural, and for the elderly, you don't need to get nervous. You should remind yourself that these are professionals. They are helping us. If there are the kids, we should try to calm down them. Okay, thank you. Starting from January the 27th, our press conference has received a lot of interest and attention from the media and the general public. With the intensification of the epidemic prevention and control, we are going to invite more experts to come to our press conference. So, starting from tomorrow, we are to relocate our press conference to engage more experts and offer a more comfortable press conference venue. You are always more than welcome to put forward your questions. And see you tomorrow at the same time. Thank you.